Hi, everyone who's joined us so far. This is Cook County Commissioner Donna Miller, and we will be getting started in just a minute. So thanks for joining us. Thanks to everyone who's joined so far. We're going to get started in just a few minutes, so hold on, please. Well, good afternoon, everyone. I'm going to go ahead and get started. This is Cook County Commissioner Donna Miller, and I really appreciate you all joining us here today. I'm just going to pull up a little bit of information before I get started, and we're waiting for one more speaker. We will begin. So thanks for joining us today. I wanted to welcome you to our town hall series focused on healthcare and COVID-19 in the Southland, where today we're going to be focusing on the social determinants of health and what that means from a healthcare provider standpoint. So as many of you know, I'm the Cook County Commissioner for the 6th District, which is in the south suburbs, south and southwest suburbs. I just like to remind people that where that is, it's 36 different municipalities in the south suburbs and southwest suburbs. For some of you who also may not know, Cook County is the 2nd largest county in the entire country. So my district is located outside of the city of Chicago. The reason for our discussion today is to focus on the social determinants of health and how the healthcare community is responding to those and has been over a period of time. I also address the fact that many of us have heard in the news about the disproportionate number of COVID-19 cases in the Black community, not just here in Cook County, but across the country. And some of the issues are universal. So today I wanted to remind everyone of the staggering numbers that COVID has occurred in Illinois. Today's numbers of COVID-19 cases were 35,108. And unfortunately, there were 1,565 deaths. So every day I hear more and more about people who are being affected by this virus, and it's very heartbreaking. It's also heartbreaking to know that we have so many frontline providers and healthcare providers out there risking their lives, using their expertise to fight this deadly virus. So in suburban Cook County, the number of COVID cases are 9,313. And there have been 391 deaths. I like to separate out those numbers because suburban Cook County numbers are growing at the same rate or even more in some areas of the suburbs as the city of Chicago. The data also shows that the number of cases are relatively similar for men versus women. But the part that we really want to focus on today is the most important difference in the numbers is the rate by ethnicity. So the number of cases in the Black community are almost 3 times higher, and the highest number are in southern Cook County, and now western Cook County numbers are following a close second. So this is the reason why we want to have this talk today. We have some experts on the phone on the call with us, and let me add in someone else who just joined so I can introduce everyone properly. I want to give an introduction to all of our speakers, and thank you so much for all of you being here today. So first, let me tell you we have Richard Johnson, who is the president of Advocate Hospital, South Suburban Hospital, as well as Trinity Hospital. We also have Jacqueline Tomei, who is the quality programs manager from American Heart Association. And then we also have Dr. Dario Cruz, who is co-director, Transitional Care Management and Advanced Heart Failure at Franciscan Health Center, and that's located in the south suburbs in Olympia Fields. So we thank our esteemed panel of guests who are here today to share their expertise with us today. So without any further ado, I will love to get started with Dr. Cruz. I'd like for each one of you just to talk a little bit about your background, what you're doing, what the social determinants of health look like from your perspective, and why and how this is so important. But most importantly, at the end of this conversation, it would be great to talk about action steps and things we can do that are going to help, not just while we're in a pandemic, but moving forward. So Dr. Cruz, thank you for being here, and I'll turn the mic over to you.
Thanks for inviting me. I'm very happy to be here and talk to you guys about what's going on our side of the world. I work at the Franciscan Health Olympia Fields since before Civil War, I believe. And then having a lot of fun now because I'm doing administrative work now with transitional care and learning a lot. Every single day we learn something new. We have created many venues to deal with the problem of social determinant of health because we have a plethora of cases here of situation we have to deal with it every day. And we solve those things every single day by making rounds, we call virtual rounds, to the heart failure patients every day and find those problems and solve them real time. We don't wait for committees. We don't wait for nothing. We just go back and call whoever has to be called to take action immediately. So we're having fun doing that, and nobody gets mad at me yet, so I'm doing what I can do. And a lot of stuff we have changed here in the hospital to make it work, which I can tell you later on.
Thank you, Dr. Cruz. So Richard Johnson, can you just please give us a brief introduction and talk about the things we've highlighted?
Thank you for having me, Commissioner Miller. This is a very apropos conversation. So I'm excited to be here with my colleagues because we're all partners in what we're privileged to do, and that's serve those within our communities and deliver high quality care. Social determinants of health is a very important conversation. And what we're experiencing is we're experiencing a spotlight that's magnified tenfold of what we've already been dealing with for many years. I have the privilege and honor of serving as the president of Advocate South Suburban Hospital, as well as Advocate Trinity Hospital. And so it gives me a unique perspective, whereas on the southeast side of Chicago in the city, and then in the south suburbs of Cook County, I have the privilege of overseeing the healthcare delivery in those respective areas. And when you look at our social determinants of health, when you look at the south side of Chicago in particular, it's not an anomaly, and it's not a surprise to us that there's a 30-year life expectancy gap, which is the largest in the entire U.S., in the entire country. I was floored by this when I came on board here. And to be honest, it's one of the things that empowers me and gives me the motive to continue to push, and it empowers our team. And that gap is caused through some of the chronic illnesses that we're plagued with. So when we look at our community health needs assessment, which we do every 3 years, asthma was number one, followed by diabetes, followed by hypertension, and then you have COPD. Now, as you layer that on top of what we're experiencing with COVID and those complications, it creates a higher mortality rate, and it creates a more intensive acute care setting for patients, and it's really tough to recover, and it's hitting us extremely, extremely hard. As an organization, we pride ourselves on delivering high quality care, but also helping people live well. You guys are run around and you see that we have that, helping people live well. Well, for us, it's all about whole person health, and those social determinants are your access to education, ensuring you have high quality education, ensuring that you have access to high quality health care. Do you have great high paying jobs? As you know, some people are making a decision between medications versus job, keeping the lights on. Also affordable housing, and then ensuring that you don't have a food desert. So we look at it as all encompassing, everything that encompasses your social situation and the environment in which you live in, to give you that opportunity to thrive from a health aspect. We consider that social determinants.
Thank you. That's really great information and very important perspective. So next, I'm going to have Jacqueline introduce herself and talk about the work that's being done with American Heart Association.
Thank you. And I just want to say thank you to Commissioner Miller for bringing this together. I think it's so important to have these conversations and make sure the community is, brought together to have an opportunity to collaborate and hear what's going on from, their leaders, such as Mr. Johnson and Dr. Cruz and everything that's going on. And, I'm Jackie Tomei. I am a quality programs manager working for the American Heart Association. As Commissioner Miller said, I'm currently overseeing the Get With the Guidelines 360 initiative in metropolitan Chicago, which includes the north, west, and south suburbs. This initiative is focused on improving heart failure systems of care through engaging hospitals and post-acute care facilities like skilled nursing homes and home health agencies, as well as community partners. The goal of these initiatives is to improve health outcomes in the community by creating environments for healthcare organizations to collaborate and share best practices, as well as providing education materials and resources for patients and providers. And I've had the great honor of working with both Olympia Field and Trinity and South Suburban and several of the South Suburb hospitals. And most recently, we've also used this initiative as a platform to help hospitals communicate during the coronavirus pandemic and provide them with additional resources and information, which we've also added additional data elements to our patient management tool to assist hospitals in tracking their COVID patients with cardiovascular disease, which really is a crucial step because similar to heart failure, as we've all been saying, there is that regional and racial disparities with COVID. And while, you know, most hospitals have now taken that step to track zip code and race associated with COVID diagnosis, I want to echo what my colleagues have said with speaking about social determinants of health. Is it's important to remember that we are using a larger umbrella than just regional disparities, but we're talking about, you know, overall conditions that impact a person and the environments that they're born into, that they currently live in, that they work in. And those socioeconomic and physical factors ultimately result in an individual's overall ability to care for themselves. And whether social distancing or physical isolation is even possible. So it's in these data points that we can work together to better understand COVID and how it and why it's so greatly impacted the South suburbs and why I'm talking to you today. So thank you so much for having me.
Thank you so much for that. So what I'd like to do is have each one of you talk, but I want to start with Dr. Cruz because you're on the front lines. You're seeing these patients every single day, especially the COVID-19 patients, but then heart failure, hypertension, high blood pressure. So could you talk to us a little bit about what are the social determinants of health and how and what are you doing about them before COVID-19 and right now? And the numbers that you're seeing in your hospital are staggering.
With 71 people now admitted with COVID-19, and 18 of those are on the respirator. And then that means we have a lot of work to be done yet. And but the whole process is being affected by not just COVID-19, but particularly now because we used to see about 6 patients with heart failure coming every day to the hospital. Today we see 0 to 1. Now imagine that those people that came in before a month ago, they were very sick, and now they're not coming. And I was the only one saying that until yesterday. Cleveland Clinic sent a report out, which said that their visit for acute myocardial infarction and stroke has gone down by 40%. Now, Cleveland Clinic is a mecca of medical care in the whole world sometimes. And they're still getting less. I mean, people are so scared to come into the hospital now, they prefer to suffer at home, have consequences of being sick at home, than coming to a place where they can be exposed to a virus that can be deadly as well. So we have education problem there. How do you communicate? So what we did, we figured out to come up with a list of registry of high-risk patients. And those high-risk patients, we call them up at home to make sure they're okay. And we make the telephone visit every time we think that something is going on. And when we need to, we send the home health is still going to their house to measure their vital signs, be sure they are not congested and so on. So we take action of being with them. And with that, we figured out the way, you know what? I think we have a problem here in general, which is called trust. If the patient trusts you, they'll listen to what you're saying. So the compliance problem that we have had in the past is due to trust. So why we don't have the trust? Because we're not there with them. We're far out in a little building somewhere in Olympia Fields, but they are somewhere in Chicago Heights. So we said, okay, let's take a look on this. How can we do that? Well, we should have a process where we have community health coach to tell people about what we know about disease and go to them rather than vice versa. And then train them, support them, and be with them in the community. If we don't go to the community, the trust does not go up. Last year, a patient of mine that was coming to the hospital every couple of weeks with heart failure, every week. And I said, I asked the question, do you trust your doctor? No, hell no, I don't trust anybody. That's the problem. We don't have that communication. We don't have so we're going to go there. The second thing we're going to try to do, which is even more important for me, is that if you see a patient who's frail, elderly, and sick, cannot barely move out of the home, we're going to bring a mobile clinic to them, which will have the capability of not just the caring of the patient, but evaluating them as well as medication. We may bring up paramedics and home health at the same time with that system. So that's something we're going to try to really push really hard to be done. We go to the community to show ourselves there. It will be a new way to be together with the community, not just waiting for them to come. And that trust can improve just by doing that. So we're doing a lot of different things, trying to different ways of trying to solve the problems. There's much more to go for, actually.
So Dr. Cruz, can you tell us how would someone know if they have heart failure? What is it?
Heart failure is a this condition of the heart where the muscle of the heart gets weaker, unable to pump the blood throughout the body. With that, most of the organs suffer. Well, first you get some swelling of the legs, which means fluid accumulation, and then you may develop shortness of breath when exercise, and then a rest, and then you know that you get a little weaker as well. So that can tell you that something's not right. Besides that, we measure the weight. Weight for us is a very important weapon because a variation of weight can occur with your dieting salt, which is very common, by the way, to see that happening, particularly on weekends. So that can tell you that the weight goes up, you get swelling of the legs, you get more short of breath, you know you're sick with heart failure. And at that point on, you need to see with the doctor because we have to take care of that pretty fast. Today, we have so many medications available that can take care of that. We have people that have severe heart failure that within 6 months, they become almost normal, which is unbelievable. That's a miracle life. But without seeing them, without giving them the right medications, we got trouble with that. So we're working very well with them, but we stay together with them. We tell people that we love them. That's the most important thing. And become part of our family, of course.
So if someone does not get treated for heart failure, are they going to have a heart attack? What's going to happen to them?
Let me give you an example of that. Last year, I asked Mrs. Pamela Johnson to tell me how many patients did not show up at the clinic. We have a heart failure clinic. I said, how many did not show up? She measured from January 1st to March 31st. And she said 26 people did not show up. That was about July. And I said, okay, let's see what happens. September, I asked her to check it out again. 9 had died in September, which is 25%, 30% of mortality of people did not show. We didn't know what they were. They go under your radar, and we can't tell what's going on with them. Once they go under the radar, we're done. They cannot be treated. They basically get major complications and die. 30% of death from January 1st to September, which I thought was incorrect. But then I look back on other reports, they're the same results, not just me. So that means without treatment, we get a major problem. We have to be sure that we follow through. And now we try even further, see people more often than rather longer time, because the more you contact people, even by telephone, a short time, it gives a chance for them to understand better their condition. And not believing that you're sick is very important because they don't know they're sick. And they don't take the medication because they don't think they're that sick. They're in between the being in the hospital, they're not sick. So we have to make sure we tell them and teach them all the time we can. We spend a lot of time doing that.
Excellent. Well, Mr. Johnson, so what do you see in your hospital system as barriers or reasons, as Dr. Cruz mentioned, that maybe patients are not coming to the hospital? And what type of outreach are you doing along these lines of social determinants of health, as you talked about in the very beginning?
So I'm glad Dr. Cruz mentioned several of those points, because I think there are a few of them, all of them really resonated with me, but a few I want to point out. And that the whole premise around trust. Healthcare, you're in a vulnerable state. I mean, each of us have all been consumers of healthcare, or we've had loved ones that are consumers of healthcare. And chances are, when you're going to a hospital, it isn't because you just want to be there. Oftentimes I joke, I'm a father of 4, and I enjoy going to the hospital every time for the 4 kids, but I don't know if my wife enjoyed it as much as I did. But that's the only time that I can see people running to a hospital. But he's right, and that trust factor I see is that's something that over years and years of mistrust, of inequities, of not being able to align with your provider, that's eroded. And so for us, what we do is we reach out to build that bridge outside of the 4 walls. And I think it's extremely important as you talk about building trust and you talk about getting in a community, which is what it's important to have diversity in terms of your healthcare providers to reflect the community you serve. I'll be the first to tell you it's a personal story really quickly. My brother was 6 years my senior and having health complications, and he's in Miami and we're from Miami. And the first thing when he called me, he said, I don't trust my doctor. It was similar to what Dr. Cruz said. And so, being that we're in the position, I flew him up here to Chicago, to Southside, to see my primary care provider, which is Dr. Tony Hampton, by the way. He's awesome. But he came up to see my doctor, and they built that bridge, and they talked about sort of the challenges that he's having, right? But when you think about social determinants of health, not everyone has a loved one who's in the position that I'm in, where I am. I work with clinical healthcare providers that are excellent, and then we have means and access to get you here. So in my head, as chief executive and president over, I always put myself in the shoes of the community. And what we do is we go out, whether it's a telehealth platform, whether it's our educators that we have there in the community health events with our local partners like AHA, with our other partners like Franciscan Health and other healthcare providers who share the same mission we do. It's a divide and conquer deal to get out in that community, work with those faith leaders, and do your screenings, do your education, and ensure that they have someone they can connect with that follows up and helps coaches them. These are some of the key components of our plan, and it's more of a journey. It's a mission. You know, it's not a sprint that you just sort of get there. Trust is built over time, and our goal is that we partner with our FQHCs and our community partners that we have to do these events in the community where people can see, feel, and believe that healthcare is real and that we care about their quality outcomes.
That's great. Yep. And trust is a huge component for everything. And I like the fact that both of you have addressed that. So Jackie, so from your perspective, what do you see for the social determinants of health and the impact that American Heart Association is making to change those outcomes in specific communities, especially in these communities of color?
So the American Heart Association really works not only with, our hospital partners, but it's bringing together specifically, within our Get With The Guidelines 360 collaborative, it's listening to what the community and these hospitals need to ensure that we are, keeping our finger on the pulse of what differentiates the south suburbs from the west suburbs, from middle, from Chicago Central, from the north suburbs, because not all hospitals are created equal and not all areas are created equal. And when we bring together these collaborations, it's incredibly important that while, yes, we're working to try to standardize processes, standardize doesn't mean the same. And so it's working to understand what that hospital can do differently because their community is different and why, and their resources are different. And so working not only because their understanding their community might need a different kind of resource, might need a different program, but the goal, the outcome, the adherence is still the same to those evidence-based guidelines. So how can we help the hospital create a program that works for them? And that's why the American Heart Association has boots on the ground staff. That's why we have people like myself that are in the hospitals doing one-on-one consulting, that are working to create programs that are built around what the hospital identifies and what the community identifies as the primary goal and the primary needs of the community.
So Jackie, that's an excellent point too. So as we know, heart disease is the #1 killer, not just in our area, but across the country, right?
Yes.
And so, and in Cook County and everywhere. So, but when we look at what Mr. Johnson talked about, it's about the wide discrepancy of lifespan, 30 years difference from one side of Chicago specifically, or the south suburbs, to another side. How can or can you give us an example of something that's really focused on an area that has, that shortened lifespan versus the area that doesn't have a shortened lifespan? What's a program that you're working on that helps people in those areas with a shorter lifespan?
So I'll talk about two different things. One is something that's common and one is something that's different. The thing that's common is that we really push something that's follow up within 7 days. We are really encouraging all hospitals, for heart failure patients, when they are discharged, they need to have a follow-up within 7 days. And what's so crucial about this is that this provides a patient with a safety net. This provides them, when they are discharged, they know they're coming back, they know they have a visit, and they know that this is, that they're not just going out into the world doing this by themselves. However, when we're talking about patients that are in more central Chicago or North Chicago, where it's easier for them to get to a hospital, we want them going back to a hospital or a heart failure clinic. However, working with Dr. Cruz and Trinity and South Suburban and Advocate Christ, we're talking about home health agencies. We're talking about telemedicine. We're looking at solutions that keep the patient where they are, because we know that transportation is a bigger problem. We're talking about patients that might not be comfortable going back to the hospital again, that they're going to cancel that appointment no matter what. So it's solutions that, again, we have that standardized guideline evidence-based therapy, but we're going to look for a solution that is specific to that area and specific to that community.
And when it's really about educating the patients, like Dr. Cruz, Mr. Johnson, you're talking about that too, coming back in 7 days. So you might think, or people out there might think, well, of course, everyone knows that, but they really don't, right? They really don't know that they should come back in 7 days, and that would really improve their outcomes to a greater degree. So actually, like, one of the things that was shocking to me too, when I learned more about all the disparities in healthcare, was the amount of people who don't know CPR. So one of the things I did as a commissioner was, the first thing to do was to, I introduced a resolution to have all Cook County employees trained on CPR training. So it's been going on for about 1.5 years. We've trained hundreds of people, but I was shocked by the data about the bystander effect, that people in a certain zip codes, probably these same zip codes that have disparities as to lifespan, also don't know how to do CPR. And when we educate the community, it uplifts the entire community to do better for heart disease as well as other issues that related to healthcare, but also helps to improve those social determinants of health. So these are things we can all work on together as far as education goes. So Dr. Cruz, what other things would you want to focus on as it relates to these social determinants of health right now in the COVID environment?
I'm glad to have Mr. Richard Johnson on the line, because what happened now is, something a little different. When Metro South closed, the patients that used to be in that area, they start moving to Ingalls Hospital, which then becomes full. And then from there on, they move back to South Suburban Hospital, which also becomes full, then comes to us. So now we're seeing a lot of Advocate patients now, all the time. And when they come out from us, by the way, we see patients 2 days after discharge, not 7 days. That's a mandatory for our team to do that. We give the appointment before they go home. But then when it comes to some other systems like Advocate, we really got a problem, because we don't even know who to call. I called a cardiologist the other day to tell the patient's here. Okay, fine, and boom. That's not the way we want to do it. We want to make sure there's communication, there's a transfer, a warm hand pass on those patients. That does not exist right now, but we need that badly to be able to achieve results. So I'm Dr. Mr. Johnson, but I have to talk to you later on about other things, like if you have a population that's vulnerable population, and we're all dealing with that anyway, why don't we do that together rather than being separately? Why don't we create a system where we have Ingalls, your side, and my side, say, let's handle that here together rather than being separately trying to solve those problems. Sometimes it's too huge for one hospital, and we need to be associated somehow to help out each other. So we do those things. What I'm concerned about is behavioral health. Extremely concerned about that, because we see patients, 1/3 of the population that comes to the emergency department has behavioral health problems. We all know that, 1/3. So they coming in for heart failure patients. We see every one of them. We have a behavioral health consultation. Every one of them, no matter what they come, they get it. They have to be seen by the psychiatrist, and then we try to get them to go someplace to have follow-up. They never go. Well, not only they don't understand they're sick, but also there's no place to go. So there's a major vacuum here. They're walking the street right now with a disease that can kill them and kill somebody else. And having a heart failure and depression increase mortality tremendously, and we're not taking care of those parts. And if we don't do that, we're not doing. That's part of the problem when you see a different population, that you see higher depression in one area, less in another area, mortality goes up. And when you're depressed, do you take your pills? You don't. And and when isolation, even worse yet. When you isolate by itself, we got a problem. We have to see, how can we create a system where the community go close to people alone? How can you create a system we can see them at home, make sure they're okay? They're isolated. They don't do too well isolated, and we're not doing anything. So, Mr. Johnson, we have to talk to each other every now and then. Be sure that we do the right things together.
No, I agree. I think.
Well, so Dr. Cruz,
Yeah, I'm sorry.
go
I
ahead.
think
I'm sorry.
you're spot on. And honestly, in any crisis, I always try to look at things and find the silver lining that's there. But every crisis brings about a great opportunity. And if there's one thing from this crisis with all of us, and we're hit extremely hard on the south side, as opposed to other areas, our service region, our service area, we're seeing higher proliferated COVID positive numbers and PUIs. And so we're having to address that. And each of us respectively are holding the fort down. But I think as we come through this, as we stabilize and take care of our patients, our collaboration and how we go about addressing social determinants of health. And to your point, ensuring we have medical access to medical records and things of that nature, and just partnering to work together so that it's seamless. I think you're spot on. That's critical. We will definitely have to, work hard to fortify that. I know we're skipping ahead because I think you're going to go to what do we do at the end, but that was a great point.
That's okay. No, it all fits together. But Dr. Cruz, I just want to go back one step. So when someone comes in and you said they do get a mental health evaluation, so what does that look like? How does that conversation go to make them feel comfortable that this is just part of a service that they need and it extends to their whole overall health care?
Think about, you come to a hospital with a heart failure, shortness of breath, you can barely breathe, you're sick, but somebody tell you, I'm going to take care of your depression as well. That doesn't resonate so well. They want to get out of there. To understand they're sick because of other situations is very hard to make them understand. When they get out of the hospital, they forgot about the whole thing. It doesn't work too well. We see patients coming back with the same problem 5 times in a row, the same psychiatric problem, and they just don't have treatment outside, which is not the way to go with our population, which suffers a lot with that. Depression is prevalent in the Black population, and we should take care of that before we take care of the medical part as well. It's very important for them, for them to not get sick. So we should deal with that. And I don't know if I want to tell you about Mr. Johnson. We are supposed to have a forum on social determinants of health on May 9. We have to postpone, obviously, because I want to invite Ingalls Hospital, the area here, to get together to talk about exactly that. How can we all work together and make sure we have a system that takes care of the problem? And I think that Ms. Donna Miller is also invited for that, and so is Mrs. Tomei, when it happens.
That's great. Yeah, we all need to do the work of the community, which is great conversation to have, but also aligning all of these different assets that you have at one hospital that another hospital might not have, and just being able to exchange information to increase the health of our community. So Jackie, that's what you're focused on as well. And anything else that you wanted to say about how just that access looks hospital to hospital, and how American Heart Association helps increase the level of education?
Yeah, so we have multiple initiatives around various cardiovascular disease states. We've had, I think, 3 in the last year, one around AFib, one around smoking cessation, and one around the heart failure initiative that are really meant to be hospital collaborations, and they're usually funded. We offer, we are always looking for hospitals to be involved, as well as often post-acute care facilities like home health, like skilled nursing facilities. But they offer the opportunity to really bring together these hospitals and these post-acute care facilities and community centers to discuss exactly what Dr. Cruz and Mr. Johnson are talking about. That opportunity to collaborate, let us know what resources are needed for continued collaboration, and allow, the American Heart Association to really be that collaborator and that think tank, so that we can assist, and get through some of those barriers that often happen when, you're trying to bring together large systems to do it together. So we can create those resources. We can, we can create kind of those communication pathways and break down some of those silos. So that's one of the opportunities that we have done with this heart failure initiative. And I just kind of want to touch on what you're asking regarding psychosocial risk assessments, because that is something that has come up with this Get With the Guidelines 360 initiative, is those psychosocial risk assessments for patients And it's often, I think when we talk about psychosocial risk assessments and depression, patients are often like, I don't need that, I'm fine, you don't need to talk to me about that. And realistically, when a patient is entering a hospital and they're getting a psychosocial risk assessment, it's not a bad thing. I've been a big proponent, many people are a proponent that every single patient should be getting one of these, because it's not meant to assess, are you unhealthy? Are you mentally unhealthy? Are you mentally unstable? No, it's meant to really assess what needs do you have so that the hospital can help you, whether it's you don't have consistent transportation, so maybe they can schedule your appointments on Tuesdays when you do know you have transportation, or do you have a caregiver that's there all the time that helps you with your medication? Do you get medications confused? Maybe you need a pill box. And it's just really understanding what your limitations are. And I use that word probably incorrectly. It's not just your limitations, but your limitations and your strengths. And so it's an understanding working with the hospital. And so when you hear as a patient that, oh, you're getting a psychosocial risk assessment, or you feel that a physician or clinician is asking you leading questions, don't look at it as they're questioning your mental acuity. No, they're just trying to make sure that they're giving you the best care possible.
So how do we make sure people feel comfortable with that? Because when we talked about trust before, if they do feel that, they might not tell the truth if they don't trust the healthcare provider who's asking psychosocial questions along those lines.
I think that's a very tough question. And I think that's one that the healthcare profession has struggled with for a very long time. There is, skills that social workers have and have learned with specific kinds of interviewing to do this correctly. But Dr. Cruz, I want to pass that, off to you if you have any specific insight on that question.
There's a lot of things going on our side. We try to coordinate the care. In other words, it's not just one doctor, one nurse. We have to go everywhere the patient can. And we call that the migration of patients. They go to places. We never lose the patient, they never discharge anyway, never go home. They all go someplace else. So if they go to a nursing home, I go there. I make sure that now I'm creating a center for heart failure in 2 different nursing homes we call excellent nursing homes. So we'll be seeing people there, make sure we're close to them. We all follow them from one place to the other. Our home health care is connected with us through EPIC, we call secure chat. So anything that happens to the patient in the hospital, they can tell what's going on outside, which means the nurses know, the group of heart failure we have knows, the primary care knows what's going on. It's called EPIC secure chat, by the way. If you guys don't know that, you should have, because it works beautiful for us. Communication. So when the patient understand that we talk to each other, that when you come to the office, I have me check your chart. Well, they should know before they go there. And looking at the computer doesn't help at all. So we try to tell our young kids, doctors, to say, look, you're seeing a patient, not the computer. Once they see you look at the computer, they don't trust you at all. So a new kind of education to occur today to make sure that we teach our young kids to learn. Trust is the most important thing for treatment. Without that, nothing's going to work forever. So one thing that I was going to tell you about is the trust that we have with the current insurance company, private insurance companies. They pay our hospital much less than they pay in Chicago, even when they pay for South Suburban Hospital, by the way. So that we are dealing with a huge amount of patients that are very vulnerable patients, very poor, without insurance, but we get less payment. And I told my boss about that. I said, look, NFL, when you take a last place on the league, next season, when you have the draft, you're the first one to pick the best players. Here it's totally different. We got the worst players again, and then we keep losing. So something has to be done, investigate why we get less money in our south side to take care of the same vulnerable patient, even worse yet, but we are still the last in the league.
That is a huge point that's probably been an epidemic for decades in this area. And just talking about that specifically helps bring it to light so that people who have to come to the hospital are aware of that type of discrepancy. So Mr. Johnson, do you see the same sort of thing at your hospital?
So one of the things that we focus on, I think it's extremely important in this, no margin, no mission. honestly. And so you need to be able to power our mission, and our mission is to take care of those irrespective of your ability to pay. So that being said, we work extremely closely with our revenue cycle team. I meet with them often. We review that often because, Dr. Cruz, you're right. As you know, how healthcare is convoluted, and there are a lot of things that move extremely fast. And so on our end, we have to make sure that that we're working with those payers to ensure that the care services that we're delivering, we're receiving adequate payment on. And that's something that is, you can't sleep at the switch on that. And to your point, you continue to negotiate those contracts that you have that are there. And we have a robust team at the system level that focuses on that. And then my job is ensuring that we keep our eye on the prize to make sure that we get the adequate payment in order to meet the mission that we serve to our community.
Well, one other thing, we talked a lot about the health outcomes, and we talk a lot about that in every aspect, whether it's from American Heart Association, an administrative aspect, a provider aspect. So would each one of you talk about what that actually means, just besides living longer? What does improving outcomes look like? And this does relate back to the social determinants of health. So Dr. Cruz, can you just, I think you gave a few examples, but what else do health outcomes mean to people?
Quality of life is crucial. After all, if you have a bad life, you might as well not be alive. But we support people every time they come to see us, based on make sure they understand that we're there to be with them. We call them our family, and that works very well to create the ambience that people can trust somebody. We are dealing with them at home. We call on them every time we can. Right now, with the telephone and with the virus going on, we have to do the telemedicine. But one thing I didn't tell you about is that our patients with telemedicine, they can't do too well. Number one, their number of units of minutes is short when they get the free phone, and many of them have a flip phone, which doesn't work too well for internet, by the way. So we got a problem now having to find a way to have support for that as well, which is we're trying to right now. We work on that. We're trying to get now equipment at home for free, which I talked to our vice president. He's working for that telemedicine to have free blood pressure, free oximetry, free weights, and make sure that we see the patients well, all for free, because we think we can handle that. And that offers them the support that they need to have when they can come to us. Otherwise, well, the quality of life goes down when they don't take care of themselves, of course.
Well, even talking about having a flip phone versus a smartphone is really a health outcome barrier. Mm-hmm. So, so that's something that I don't think everyone would assume is still happening in certain communities. Mm-hmm. So, Mr. Johnson, what do you think about health outcomes, and what does it mean in the big scheme of things?
I think the big scheme, we talk a lot about trust. Jackie hit on something that I think is really key, and that's tailoring healthcare to the respective community or to that person that you're delivering healthcare to. A big part of it is it sounds elementary, but it's listening. I think you have to listen to your patients and what they're telling you. If something doesn't feel right, or I know my body and this isn't, we have to listen. That develops trust as well. But as you listen and you tailor healthcare specifically to what it means for that individual, because healthcare or living a healthy life is different for different people. I know when you look at my diet, you'll say, okay, I love soul food. All right. So I had a physician to teach me how to make healthy soul food. And I was like, wow. Right. But we really have to get to that level as we're delivering high quality care to meet people where they are specifically, right, from a telehealth standpoint. And there's a lot in this digital space, and we are evolving as healthcare providers. But somehow we got to get to that point, whereas the reimbursement is following to be able to do things from a telehealth standpoint, because as you know, immediate access is gratifying for the world that we're in now. And our healthcare, we're following behind on that. So there are a number of things that I think determines quality health outcomes that we need to ensure that we are being disruptors and we're not just traditionally doing the things the way that we say we were going to do them. A big component of that quality healthcare is not having the ED be your primary care for a physician visit. And oftentimes in our community, and Dr. Cruz and I know Jackie, you can attest to this, we're seeing patients when it's stage 4, when it's chronic, and they're coming to the ED as a primary care visit. So quality care is getting outside of the 4 walls, being proactive, listening to our community, and tailoring healthcare to meet them in their setting and reflect the things that are important to them. I think all of those things are critical for that.
Exactly. Well, we have about 10 minutes or so left, and I was just going to answer a couple of questions that are in the chat. So a couple of people asked, what can the community members do to help for this, changing healthcare outcomes? How can regular community members participate? What ideas do you have? I think American Heart Association might have some ideas on where people can go or what they can do, but it's great to have people in the community engaged, and maybe we could just talk about some of those ideas.
So I will say, there's an echo, I apologize, that there are several opportunities, to get involved with the American Heart Association, and we're always looking for volunteers. But most importantly is if you know of a relative or a neighbor, or especially now during, the coronavirus epidemic, that is, at high risk or has a cardiovascular disease, being a caregiver and being aware of what that means and keeping yourself educated as a caregiver. You can find a lot of resources at heart.org, and keeping yourself educated as a partner in their care. Cardiovascular disease doesn't just impact the patient. It is a family, it is a community, it is a entire, culture event. And so please, keeping yourself aware, keeping yourself engaged in what's going on is incredibly important. And so we have several organizations that are involved in food insecurity. We have several organizations and several programs that are involved in many different our programs with our hospitals. So if you are interested, please just reach out or go to our website, and we would be happy to have you volunteer.
I'm going to have Christian, who's in the background there, he can put your website up in the chat box so that people will be able to see that. But that's a great point as well. Dr. Cruz, do you have another idea of what community members can do?
Yeah, this story about us being at 4 walls, I think it's gone. I mean, we need less bricks and mortars than ever before. We have to be out. In other words, we're going to move into the community rather than waiting for them to come to us. They have to understand that we're working in the same vicinity. We're working the same problems. So why don't we stay together? So we're going to move into that. We're going to contact the churches and clubs, whatever we can find that we can. In fact, you told me that the people around the area, they can be in touch with us here. We're going to get with them, create those healthcare coaches in the community, and make sure we support that every time we can. Running education for patients every single month in our place regarding heart disease and heart failure and stuff like that. And 50 patients comes in every month to see us, and they love it. They get together with us. They understand that we're trying to help them out with that. So the more you get closer to them, the better. Create a system of communication. Don't just wait for things to happen. Create your own system. How are you going to do that? How do you plan it before you do it? So plan that first. Somebody planned how to communicate with doctors. Well, how to communicate with the community. How do you do that plan? When you do that, they know that you're not just trying to be paid what you do, but you're trying to take care of their problems. They have to understand that. I used to be a younger guy in Rio. My mother told me, never run from the dog, but they can smell fear. Well, they smell when they like you or not. They smell if they have trust on you or not. they can.
Very good. Yes. Okay.
I echo the sentiments of my colleagues, and I would just highlight the education component. That's extremely, and it's cliche, but each one teach one is important. I mean, I share a personal family story here, but each of us have family members or friends or colleagues that or loved ones that we need to be stewards in their healthcare journey as well. And it's literally going to take all of us. So in combination with us getting out in the community, we can only do as much as the community is willing to receive, right? So it goes both ways. And I would say we all have that fiduciary responsibility of taking care of each other. I can promise you this, those healthcare providers that are not only on this virtual town hall, but those we partner with, we are extremely dedicated and committed to delivering high quality care and taking care of people. That's what we love to do. We're inspired to do that. We get up in the morning, but we need to make sure that our community is as inspired as we are and reach out to your loved ones and those that you care about and sort of lift them up as well.
Well, thank you for all of that. I think we answered most of the questions that were there. They were similar in nature to some of them. And we did talk about the food insecurity. That was the last one here. And just what's available. So American Heart Association has things available. And I do believe that each one of your hospital systems also has things available that they can provide resources to patients on. Well, I just want to summarize something that I've heard over the last couple of days when I had other town halls as well as this one, is that patients need to recognize, or we hope that patients will recognize, that their healthcare providers are their partners and that they should reach out to them for help. And that's where the trust issue is so huge. And there's such a breakdown in that. So we hope that when you have a wonderful doctor like Dr. Cruz, how could you not trust him? But I'm sure it's just because you're afraid and you don't know what to do. And so you kind of get immobilized and you might do nothing. And that's where having this better level of education, as Mr. Johnson focused on, is so important and so key. And we can all do our part by researching information, by getting involved, advocating for a loved one, as Jackie mentioned too, that it's a family. It's not just one person who has this condition. It affects the whole family. And then it also affects the community, because the resources that might not be there or that are there might either be underutilized or they just aren't there, so you can't utilize them. So we can all work together to partner on a higher level to increase access to healthcare, as well as improving these outcomes over time, not just right now while we're in a pandemic and everyone's talking about it, but I know all of you talked about this in your careers for longer than just right now. So thank you for everything that you do on a daily basis to improve the outcomes for people in our communities and make people's lives much better. And we will post information here, and we want to encourage everyone who's watching, you can share this information via Facebook beyond today. So it'll be living on the Facebook page as an archive page. So thank you all for participating. Appreciate your professional expertise, as well as your time and talent for sharing your information with us today. So have a great day.
Thank you. Thank you.
Thank you.
Bye-bye now. Thank you.